This is a presentation on laser eye surgery. We will first discuss laser tissue interactions, then optics of both the excimer and femtosecond laser. Next we will see how both these lasers are incorporated into PRK, LASIK and SMILE laser eye surgery. Finally, we will discuss this all in a case. The laser tissue interactions of both the excimer and femtosecond laser are caused by high energy short pulse lasers. The absorption of the excimer laser's high energy ultraviolet radiation overcomes the intermolecular bonds, resulting with ablation of tissue fragments as shown in the diagram. The femtosecond laser provides high amounts of ionizing energy during ultra-short pulses, causing a plasma shockwave and cavitation bubbles to disrupt tissue. Consecutive pulses create a cleavage plane. The ultraviolet radiation is emitted from an unstable dimer, typically fluorine and argon, when dissociating back to its ground state. The laser energy density correlates well to the ablative depth, providing micron accuracy. Technology advances include beam delivery, eye tracking software, and wavefront-based treatments to increase the visual outcomes of patients undergoing PRK or LASIK. The important difference of the femtosecond laser is the ultrafast pulse in the femtosecond range, which reduces the damage to collateral tissue, and with increasing frequency we can offer smoother incisions and reducing the overall energy required. This technology is replacing the use of the microkeratome during flap creation for LASIK and is offering lenticule extraction with SMILE. Producing pulses in the femtosecond range is achieved by mode locking, where many oscillating modes of different frequencies constructively interfere to become locked in phase. PRK is a two-step process, first involving the removal of the corneal epithelium, then ablation of the central corneal stromal bed by the excimer laser. A disposable bandage contact lens is placed over the top for protection during the recovery period. PRK is an older technique utilizing the excimer laser. Patients will expect a slower visual recovery with more discomfort. There is increased risk of corneal haze, epithelial defects, and regression, especially at higher refractive areas. However, this technique remains a favoured option in a number of situations, taking into account the quality of the patient's cornea, lifestyle factors, and concerns such as dry eye. The modern LASIK procedure utilises two lasers. The femtosecond laser first creates the anterior corneal flap, which is reflected out of field. This allows the excimer laser to ablate the residual stromal bed before returning the flap to the original position. Compared with conventional microkeratome, femtosecond laser offer improved safety and precision of corneal flap creation with a reduced complication rate. LASIK has been the most popular refractive option for the last 2 decades, offering predictable outcomes and experienced hands, enhanced by the introduction of the femtosecond laser for the creation of the flap. Most important benefits include faster visual recovery and less distress for the patient. Important considerations include the high risk of dry eye, flap-related complications, interface reactions, and corneal ectasia. SMILE is a procedure completed by the femtosecond laser, first forming a series of bubbles to create the lenticule surface within the corneal stroma, then creating a 3mm side-cut laser incision to provide the keyhole access for the lenticule to be extracted. SMILE takes advantage of the femtosecond laser with evidence supporting similar efficacy and safety as LASIK. Its minimally invasive approach avoids flap-related complications and there is less dry eye compared to LASIK. Although SMILE is new and still evolving, for the surgeon it's more challenging to learn and there is a lack of rotational eye tracking software. It currently remains unavailable for hyperopes and enhancement is usually done with PRK instead of SMILE. Visual outcomes across the 3 laser eye surgery options are relatively comparable, and so the choice is a shared decision between the individual patient characteristics and the surgeon preference. Before offering surgery, ensure the patient is a good surgical candidate. This includes appropriate history, exam, and investigations to ensure the eyes are healthy with a stable refraction and without any contraindications for proceeding for surgery. And so we have a patient with compound myopic astigmatism where both focal points lie in front of the retina. The power cross and positive cylinder prescription are written for reference. I would recommend LASIK for this patient with confidence of offering the best outcome. I'd explore any lifestyle contraindications for the flap, such as being in the military or contact sports, as well as explaining the risks of dry eye. SMILE in this patient is more challenging given the thin lenticule needed to be dissected and the lack of rotational tracking, which is important given the astigmatism present. In experienced hands, this could be the preferred option if dry eye was a significant concern. PRK is a good option for this prescription, but a fallback if contraindications are detected for LASIK or SMILE. If presbyopic, there's the option for monovision or laser blended surgery, where the dominant eye is set for distance, leaving the non-dominant eye myopic for near vision. A trial of contact lenses helps identify successful candidates. Non-operative options include spectacles, which are cheap and non-invasive but associated with negative visual effects and are inconveniencing for patients. Contact lenses, on the other hand, are optically superior to spectacles but are more expensive and have irritation and infection risks. Thank you.